I'm sure most of you have experienced something like this in your life. You wake up, you can't move, and there's a creepy old man in the corner. This isn't something completely mysterious, it's called
Episodes of sleep occur right as you are falling asleep and right after you wake up. During these episodes, you typically can't move anything except your eyes. Roughly 30% of people have experienced this at least once in their life. Sleep paralysis has plenty of causes, including sleep deprivation, PTSD, insomnia, and a general family history of having sleep paralysis episodes. As with the next two things we will cover, sleep paralysis falls under the category of a parasomnia. Parasomnias are a list of conditions that consist of abnormal movements and experiences during sleep. Sleepwalking, also known as somnambulism, is a phenomenon that involves the subject walking and doing complex tasks while in their sleep. While the exact cause of it is unknown, some contributing factors include lack of sleep, stress, alcohol, and some medicines.
sleepwalking is most common in children. While most people don't need treatment for sleepwalking, there are some ways to prevent it. In children, a timed awakening may be used to prevent sleepwalking by waking the child just before they would usually start walking. Alternatively, you could just drink them, although some medicines might actually backfire and make them sleepwalk more often. Of course, sleep disorders aren't always funny, sometimes they're pretty annoying, or just downright terrifying. If you've ever woken up in the middle of the night from someone screaming like 1,000 souls crying out from the pits of hell, then you might be familiar with someone afflicted with night terrors. Night terrors cause victims to, well, scream out in the middle of the night. The cause of this is unknown, but research suggests that they could happen after fevers, drinking, and stress.
Night terrors happen when your consciousness is stuck between sleep and waking. You are not fully awake when the night terrors happen, so it's hard for other people to wake you up. This doesn't typically require treatment, and most children outgrow them. Treatments mainly focus on addressing triggers, and if it's related to a health issue, treatments may focus on that. Like sleepwalking, a timed awakening before the patient is expected to have an episode may help.